Morning, Mr. Jones. How are you?
Doctors' surgeries have had to adapt during the COVID pandemic. Virtual consultations being just one example. And some patients have actually preferred it.
It's really good, so thank you very much. It's worked very well for me.
Others, though, may be hoping that now restrictions have been lifted, things will be quickly going back to how they were. But that's not going to happen anytime soon.
COVID is still a huge problem with very, very large numbers of infections, and the rates are rising. That doesn't mean that you can't get healthcare help or see a doctor, though. Anyone that needs to see a healthcare professional will still be able to, and there's a variety of formats that is done in. So there are telephone calls, there are video consultations, and where needed there are face-to-face appointments. So anyone that does require healthcare help, please do contact your surgery.
Patients are also being urged to consider exactly what kind of help they might need.
Okay, do you mind just swinging your legs
Yeah,
up
of
and I'll
course,
have a
yeah.
look at your knee?
A doctor may not always be your best bet. Neil is a physiotherapist, one of a number of specialists available at this practice in Taunton. They also have nurse practitioners, paramedics, pharmacists, a mental health worker, and nurses who are experts in COPD, asthma, and diabetes.
The idea of having people like me in the surgery is that I'm a musculoskeletal specialist, so that people can see me first time of asking rather than the GP needing to refer on for the expert opinion.
The NHS has already announced that in all healthcare settings, hospitals, pharmacies, doctors' surgeries, infection protocols aren't going to change.
The fact that the guidance has meant things can be done differently, but that doesn't mean everyone has to do things differently. Any healthcare building has some very vulnerable people, and for many medical reasons, some of those are not able to have the COVID vaccinations. So these buildings have the most vulnerable and also the most susceptible people within them, and to ensure all staff and all patients are going to be kept safe, we will still be using the guidance of asking everyone to wear a mask when they are inside the building, both in waiting areas and during their appointment. All the clinical staff that you come into contact with will be wearing their protective equipment, with masks, and social distancing will still be in place.
And in these difficult times, every healthcare setting is asking all patients to be patient.